Not every lump and bump down there is a bartholin cyst. So let's figure this out. Hi, I'm your local OBGYN. I love women, and let's learn about it. Recently, I had somebody come in to discuss a thing down below. So mom ran her over to see me and was freaking out thinking that her kid had cancer. And you know, when you have these younger patients and you're dealing with down there, you gotta be real sensitive because these are girls that have never had anything happen down there and you don't want to traumatize them. I was able to figure out, okay, not at the location of a bartholins because it was up top near her pee hole and ultimately wasn't tender, didn't cause her any pain, and she has no idea how long it's been there. You looked at it, it looked like this pink cyst bulging out from under the pee hole, okay? And again, she has no idea how long it's been there, but as a teen, why would she? Because, you know, we're all kind of ignorant to down there, whether you're 15, 25, 35 or more. I don't know how long it's been there either, but there's something called a urethral diverticulum, and it's when the tube that is your pee hole suddenly pushes out like a little branch that can go through the vagina. It's not opening, she's not peeing through her vagina, but it looks like there's this little collection that's sitting there pushing through the skin, and that it's like a pocket. It doesn't actually do anything. It can cause some symptoms. I don't specifically know why she has this, but the risk factors for a urethral diverticulum can be connective tissue disorders, constant straining, okay, chronic infections. And what women will complain about when they come in saying that something is pushing out is chronic UTIs, dribbling every time they pee. Because they pee, they think they're done, but there's still a little bit of urine stuck in this spot and it eventually dribbles out. Some people will have pain if the infections are sort of more localized in that area. Now, does she need to emergently do anything about this? No, she doesn't need to because it's not causing her any pain or symptoms. But if you are looking at it from a cosmetic standpoint, you do see a little bulge. Again, nobody's going to really know what they're looking at because most teenagers are kind of like idiots. It could cause all of those symptoms down the road. So it would be something that can be surgically repaired by a urologist or a urogynecologist, not by a local OBGYN, because don't let anybody who doesn't know exactly what they're dealing with put a scalpel in and be like, oh, it's an abscess. Because if you just poke some random hole in there, you are entering a very sterile bladder system and you could totally screw it all up. So make sure before somebody starts poking and prodding in your lady bits, they know exactly what they're doing. Because if they poke in the wrong spot, you are going to be left with a world of problems.